If you have melasma and nothing is working, this video is for you. I am Dr. Sandra Lee, skin and face specialist. Today I tested the most popular Korean melasma products. I am giving you honest clinical results. Excited? Subscribe now. Let us get straight into it. Melasma is a chronic pigmentation disorder caused by overactive melanocytes in the skin. It appears as brown or gray patches, usually on cheeks, forehead, and upper lip. Melasma differs from normal dark spots because pigment forms deeper in the dermis. Deeper pigment makes treatment slower and relapse more common. Size. Hormonal changes often trigger melasma, especially pregnancy and birth control hormones. Ultraviolet radiation strongly stimulates melanocytes and worsens existing melasma patches. Heat exposure from sunlight or cooking environments also increases pigment production. Inflammation inside the skin further stimulates melanin activity. Melasma frequently returns because melanocytes remain hypersensitive to heat and ultraviolet radiation. Many products fail because they only treat surface pigment layers. Effective melasma treatment must reduce melanin synthesis and calm inflammation simultaneously. Korean formulas often combine brightening, barrier repair, and hydration within one formulation. Some by MI Niacinamide serum contains niacinamide, arbutin, and plant-derived brightening compounds. Niacinamide reduces melanin transfer from melanocytes to surrounding skin cells. Most Korean formulas use concentrations between 2 and 5% niacinamide. This range improves pigmentation while minimizing irritation risk. Apply 2 drops after cleansing and toning. Spread evenly across melasma areas before moisturizer. Use once daily initially, then increase to twice daily if skin tolerates well. Always apply sunscreen afterward during daytime. After 2 weeks, mild brightness appeared across superficial pigment patches. Texture felt light and absorbed quickly without residue. Sensitive skin types usually tolerate this formula well. Avoid use if strong niacinamide products already exist in your routine. My verdict is simple. This serum supports pigment control but requires strict sunscreen for visible improvement. COSRX Snail Mucin Essence contains 96% filtered snail secretion filtrate. Snail mucin supports skin repair through glycoproteins, hyaluronic acid, and peptides. These compounds strengthen the epidermal barrier damaged by chronic pigmentation inflammation. Barrier repair helps reduce repeated melanin stimulation. Apply 1 pump after toner. Pat gently across entire face, including melasma patches. Follow with moisturizer to seal hydration. Use twice daily, morning and evening. Texture feels slightly viscous, but spreads easily across damp skin. Skin hydration improves significantly during testing period. Melasma edges appeared slightly softer after 2 weeks. Avoid if allergic to snail-derived cosmetic ingredients. My verdict is supportive. Barrier repair products improve treatment tolerance during melasma therapy. Beauty of Joseon Glow Serum combines rice extract and propolis extract. Rice extract contains amino acids and vitamins that brighten uneven skin tone. Propolis provides antibacterial and anti-inflammatory compounds. Reduced inflammation helps stabilize melanocyte activity. Apply 3 drops after toner or essence. Press serum into pigmented areas without rubbing aggressively. Layer under moisturizer or sunscreen. Use once or twice daily. Texture feels lightweight and slightly honey-like. Skin brightness improved mildly during the 2nd testing week. Combination skin tolerated the serum without congestion. Avoid if allergic to bee-derived ingredients. My verdict is balanced. This serum supports brightness but works best with stronger pigment inhibitors. Anua Heartleaf Toner contains high concentrations of Hatunia cordata extract. Heartleaf contains quercetin compounds with strong anti-inflammatory activity. Inflammation worsens melasma by stimulating melanocyte signaling pathways. Reducing inflammation lowers pigment stimulation triggers. Apply toner using cotton pad or clean hands. Press gently into skin after cleansing. Focus application around inflamed or irritated pigment areas. Use morning and evening. Texture feels watery and calming immediately after application. Redness decreased visibly within several days of testing. Melasma darkness remained stable, but inflammation reduced. Avoid if plant extract sensitivity exists. My verdict is preventative. This toner controls inflammation that worsens melasma progression. Isntree hyaluronic acid toner contains multiple molecular weights of hyaluronic acid. Hyaluronic acid binds water molecules and improves epidermal hydration. Chronic dehydration can worsen pigment irregularities and barrier weakness. Hydrated skin tolerates pigment treatments more effectively. Apply 1 to 2 layers after cleansing. Press gently until fully absorbed. Follow with serum or moisturizer. Use both morning and evening. Texture feels slightly thicker than water, yet absorbs quickly. Hydration improved immediately after application. Melasma patches appeared slightly brighter due to improved skin plumpness. Avoid layering excessively on oily skin types. My verdict is supportive hydration. Hydrated skin improves overall treatment response. Mucin bean essence uses fermented soybean extract and fermentation filtrates. Fermentation breaks large molecules into smaller absorbable compounds. These compounds penetrate deeper layers, supporting mild exfoliation and brightness. Fermented ingredients may help regulate melanin formation. Apply 1 small pump after toner. Spread gently across face, focusing on pigmented areas. Use once daily initially. Increase frequency if skin tolerates well. Texture feels slightly slippery and nourishing. Dead surface cells removed gradually during testing period. Melasma patches appeared smoother, but pigment reduction remained subtle. Avoid if sensitive to fermented skincare ingredients. My verdict is moderate. This essence supports exfoliation, but should complement stronger pigment inhibitors. Skin 1004 Centella Ampoule contains pure Centella asiatica extract. Centella contains asiaticoside compounds supporting wound healing and inflammation reduction. Inflammation strongly contributes to persistent melasma activation. Calming inflammation reduces pigment stimulation signals. Apply 2 drops directly onto melasma patches. Pat gently without rubbing. Use after toner and before moisturizer. Apply morning and night. Texture feels extremely light and soothing. Skin irritation decreased noticeably within several days. Pigment darkness softened slightly after 2 weeks. Avoid combining with multiple active exfoliants simultaneously. My verdict is strong support. Centella calms triggers that worsen melasma recurrence. Morning routine begins with gentle cleanser, removing oil and overnight sweat. Apply Anua heart leaf toner to calm inflammation immediately after cleansing. Follow with Isntree hyaluronic acid toner for hydration layering. Apply some by MI Niacinamide serum across melasma areas. Next, apply Beauty of Joseon Glow Serum for additional brightening support. Apply Skin 1004 Centella Ampoule directly onto pigmented patches. Seal hydration using lightweight moisturizer suitable for your skin type. Finish with broad spectrum SPF 50 sunscreen every morning. Night routine begins again with gentle cleanser, removing sunscreen and pollution residue. Apply heart leaf toner followed by Isntree hyaluronic acid toner. Apply Mucin bean essence to encourage mild exfoliation overnight. Follow with niacinamide serum and Centella Ampoule. Never mix strong chemical exfoliants with multiple active brightening serums simultaneously. Avoid using high-strength retinoids during early melasma treatment weeks. Results usually appear gradually between 8 and 12 weeks. Consistency matters more than product quantity. Strict SPF 50 sunscreen prevents ultraviolet activation of melanocytes. Wear hats and avoid direct midday sunlight whenever possible. Reduce excessive heat exposure from saunas or prolonged cooking environments. Maintain gentle skincare routines to avoid unnecessary inflammation. High-sugar diets may increase glycation processes affecting skin pigmentation. Excess alcohol can increase inflammatory responses within skin tissue. Highly processed foods may worsen systemic inflammation. Balanced diets support overall skin repair processes. My number 1 product for melasma support is Some by MI Niacinamide Serum. Niacinamide directly reduces melanin transfer inside skin cells. Clinical evidence supports niacinamide for pigmentation regulation. Consistent use produced the most visible brightness during testing. Second place goes to Skin 1004 Centella Ampoule. Centella reduces inflammation that stimulates melanocyte activity. Calmer skin environment improves long-term pigment stability. Sensitive skin types benefit strongly from this formula. Third place belongs to COSRX Snail Mucin Essence. Barrier repair improves tolerance to pigment treatments. Hydrated skin heals faster and maintains stronger protection. Supportive formulas increase success of active ingredients. Biggest disappointment during testing was Mucin bean essence. Exfoliation effect remained mild within short testing period. Pigment improvement required longer consistent use. Results were slower compared with other formulas. Best product under $20 is Isntree Hyaluronic Acid Toner. Hydration dramatically improves treatment tolerance and skin appearance. Best combination is niacinamide serum with Centella Ampoule. My final recommendation is consistency with sunscreen and pigment inhibitors. Results require 8 to 12 weeks of consistent use. Tell me which product you will try first. Share this video with a friend struggling with melasma. Subscribe for more evidence-based skincare guidance. Melasma is treatable with the right routine and the right products. I am Dr. Sandra Lee. Take care of your skin, and I will see you in the next video.